What's going on, everyone? It's Alex here from Alex Physio. So today I'm going to be going over rehab exercises after a jammed finger. Welcome. For those of you who are new to my channel, my name is Alexander Kravich. I'm a physiotherapist in Vancouver, British Columbia. Today I'm going to be going over 3 exercises that you can perform if you jammed your finger or if you have a finger sprain, strain. Before we begin, it's important to be able to rule out a jammed finger from a fracture or a dislocation of your finger, as this will require different treatment approaches and different interventions. So it's important that a fracture or dislocation is ruled out to allow you to be able to successfully perform these exercises without complications such as non-union or malunion of the fracture or making the dislocation work, as these exercises aren't going to be as effective if you have a fracture dislocation. And sometimes the symptoms can overlap, so it's important that you see the appropriate healthcare provider and you have any form of imaging done to rule out a fracture or dislocation. So generally, with a jammed finger, it's usually there's an axial force or there's a force being applied vertically onto the tip of your fingers. It's usually the middle or the index finger. And what happens is that can affect the ligaments on the outside of the joint of your DIP or your distal interphalangeal joint, or your PIP or your proximal interphalangeal joint. So there are ligaments on both sides prevent the joint from being too lax or too loose. And then there's some tests that you can do to look at the laxity. So applying pressure on different sides to see how much give there is. When you injure the tendons or when you injure the ligaments, movement is important in order to try to get some more blood flow to that area. And tendons and ligaments are notorious for not getting very good blood flow. So that can affect their overall healing. But by doing exercises to try to get some more blood flow there, doing some gentle range of motion exercise and strength exercises, that can help to try to stimulate that recovery process. So the first exercise we're going to do is active range of motion for flexion. So when we bend our finger, and extension, which is returning our finger back to the start position. Usually people have a hard time getting that full extension back after an injury. So it's important that we try to restore that as soon as possible. And what I'm going to do is I'm going to block the movement of the joints below this. So I'm going to grab my hand and I'm basically just trying to bend and straighten my finger. And again, obviously this is going to depend how far you go based off of how painful it is or how much range of motion you have. Flexion and extension. And again, if you don't have the full range of motion, then you're just trying to slowly work into that and get some blood flow going. Next exercise you're going to do is now you're going to take that joint, you're going to do some passive range of motion. So you're going to take the joint with your fingers. You can use your thumb and your index finger. I'm just trying to bend my finger and straighten. So again, this is obviously going to be a lot more provocative when you're doing it versus when I'm doing it, because of course I don't have a finger injury. But again, you're just trying to move the finger, bend and straighten with your fingers and work on some of that blood flow. And then the last exercise is going to be some isometrics. So here we're trying to generate tension within the tendon of our fingers, the flexor tendons and the extensor tendons. So try to get some more mobility and some more strength in that area to try to help stimulate some of that recovery. So how that's going to work is you're going to take your other finger and you're going to basically apply a pressure down with the other hand, the non-affected hand, as if you're trying to bend your finger. And then the injured finger, you're trying to straighten the finger against that tension. So one hand is pushing down, or the non-affected side is applying a force down, and then you're trying to push into your finger. And you're basically trying to meet that resistance. And again, you should be feeling some of the muscles and the tendons around that area swelling up a little bit and activating. And the nice thing about the isometrics is you can control how much tension you put when you're doing this exercise. So at the beginning, if you don't want to put a lot of tension because of pain, there's a lot of muscle inhibition and muscle guarding, pain inhibition, then just start at very low intensities. But again, you're just working on trying to activate the muscle and the tendon. So do this for 10 seconds. You're just trying to hold, meet that resistance, and then switch sides. So now you're going to try to bend your finger, but your other hand is trying to straighten your finger. So now you're pushing your finger pad down into your thumb as your thumb tries to push upwards. So again, you're just meeting the resistance and holding. Go for about 10 seconds. And again, you control how much tension you apply into your thumb, and the thumb is going to control the tension that you're applying the opposite way. So you're basically just meeting the resistance. There shouldn't be any movement here. So you shouldn't be moving up and down. You should just meet it at the same point. So there's equal amount of force being applied down as there is up. That's why there's no movement happening. Okay, so there you have it. We went over 3 exercises that work on your rehab and your recovery. This would be the early stages of rehab following a jammed finger or finger sprain strain. We went over active range of motion of the finger flexors and extensors. We went over passive range of motion of the finger flexors and extensors. And we went over isometric contractions of both the flexors and the extensors. And we used the DIP joint as our point of reference that was injured. If you have a jammed finger where you've also injured the ligaments around the PIP joint, then you can obviously add those exercises that work on bending and straightening at your PIP joint. So you would just apply the pressure in a different position. So instead of applying it here, you would apply it around where your middle finger bone is, up and down, and then you would be bending and straightening. And again, just a different joint that you're working in, but the premise would be the same. Now, obviously, when you bend and straighten your finger, you're also getting some bending naturally of this joint right here. But the principle is the same. We're trying to restore range of motion, we're trying to decrease inflammation and swelling, and we're trying to improve function in the early stages. And then from here, we would progress to the subacute phase, so where the exercise is a little bit more challenging, to later stage rehab and return to sport activity. Generally, most finger sprain strains or jammed fingers, the rehab timeline will be anywhere from a few weeks to 3 months. From the physiological healing perspective, obviously some can be a little bit quicker, some can be a little bit longer. It just depends on a bunch of different factors, but that's generally the timeline to return back. I do have a video where I go over how to tape a jammed finger properly. You can check that out on my channel as well. So there you have it. We went over 3 exercises that go over general recovery from a jammed finger. Hopefully you found some value in the video. If you do, consider checking out some of my other videos. I have over 450 videos on various physio, exercise, and medical related topics. And if you still find value, please consider subscribing to my channel. It really allows my channel to grow and allows me to reach a wider audience. Until then, we'll see you in the next video. Thanks for watching.